St. Catherine's Medical Center, Baltimore, 5:47 in the morning. The night shift smells like disinfectant and exhaustion, the kind that settles into your bones after 12 hours of fluorescent lights and the mechanical rhythm of ventilators breathing for people who can't. Dr. Elena Volkov empties a bedpan. Her hands move with precision that seems wasted on the task. Steady, methodical, no hesitation, no disgust, just the simple execution of work that needs doing. 42 years old, medical degree from Johns Hopkins, trauma fellowship at Mass General, current assignment, janitorial rotation, punishment for what they call emotional instability. She moves through the supply room, restocking IV bags, each one placed exactly where it belongs, labels facing forward, organized by size and solution type. Military precision disguised as menial labor, the kind of order that comes from muscle memory, not hospital policy. Dr. Stevens passes in the hallway, eyes on his tablet, coffee in hand. He doesn't look up. Volkov, when you're done playing maid, bed 7 needs a sponge bath. Elena doesn't respond. Her jaw tightens for half a second, then releases. She continues working, hands never pausing. Down the corridor, 2 nurses lean against the medication station, voices low but not low enough. Can you believe they let her near patients? Nurse Patricia glances toward the supply room. I heard she had a complete meltdown in the OR last month. Nurse Jenkins nods, scrolling through her phone, screaming at the attending. Through instruments. They should have fired her completely. Elena's hand stops mid-reach, one IV bag suspended in air. Then she places it on the shelf and continues as if nothing happened. What they call a meltdown. Elena identified a missed arterial bleed during a routine appendectomy. The attending dismissed her observation, called it unnecessary anxiety. She raised her voice, insisted on inspection. The attending refused. She raised it louder. They found the bleed during closing. The patient lived. Elena was written up for insubordination and erratic behavior, removed from surgical rotation, assigned to grunt work until further review. She opens her locker during break. Inside, a folded black flag, triangle pressed, the kind given to widows. A photograph, edges worn from handling, showing a desert landscape and 6 people in surgical scrubs. The faces are faded, sun-bleached into ghosts. Beneath the photo, hidden under her spare set of scrubs, a knife. Fixed blade, military issue, the handle wrapped in paracord. The night shift knows nothing about the knife, or the flag, or the reason Elena Volkov never freezes under pressure, even when everyone around her is falling apart. The overhead speaker crackles. Code blue, ICU, code blue, ICU. Elena's head snats toward the sound. Pure reflex. Her body shifts, weight already transferring toward the door, hands ready. Then she catches herself. Stops. Not her department. Not her patient. Not her place anymore. She closes the locker and returns to restocking, but her eyes track the hallway, counting the seconds it takes for the code team to respond. 12 seconds. Too long. Her fingers drum once against the shelf, then still. The shift drags. A drunk in bed 3 vomits. Elena cleans it. A dialysis patient in 4 needs repositioning. Elena lifts him, supports his weight with her shoulder, moves him with the practiced efficiency of someone who's carried wounded soldiers. The patient thanks her. She nods and leaves. At 6:30, she takes her break in the small room behind the nursing station. Instant coffee, the cheap kind that tastes like burnt water. The wall-mounted television plays morning news on mute, stock prices, weather. Then a headline, continued unrest in Kandahar province. The coffee cup stops halfway to her lips. The image on screen shows smoke rising from a bombed D building. Civilians running, dust and chaos and the particular texture of a war zone. The kind you can't understand unless you've been inside it. Elena sets the cup down. Her hand doesn't shake, but it takes effort. The smell of burnt coffee becomes something else. Cordite, diesel fuel, sand in her teeth. The sound of the television fades, replaced by the phantom thrum of rotor blades and distant explosions. For 3 seconds, she's not in Baltimore. She's somewhere else. Somewhere hot and loud and desperately urgent. Then Dr. Chen walks in and the moment snaps. You okay? Elena blinks, looks down. The coffee has spilled across the table, a dark puddle spreading toward the edge. She grabs napkins, starts wiping. Fine. You don't look fine. I said I'm fine. Chen studies her. He's younger, maybe 35, with the kind of observational skills that come from actually paying attention. He doesn't push, but he doesn't leave either. That coffee-to-floor ratio suggests otherwise. Elena forces a smile. It doesn't reach her eyes. Long shift? Yeah. Chen pours his own cup, leans against the counter. You know, I worked with a combat surgeon once, in residency. He had that same look when helicopters flew overhead. Elena's expression goes completely neutral, flat, controlled. I've never been in the military. The lie comes easily. She's told it so many times, it almost feels true. Chen nods slowly. Right, of course. He doesn't believe her, but he's polite enough not to say it. He leaves. Elena waits until his footsteps fade and pulls out her phone. The lock screen shows the same photo from her locker, but clearer. 6 people in desert camouflage surgical scrubs, standing in front of a tent marked with a red cross. Elena is in the center, younger, smiling. The text at the bottom reads, JSOC Forward Surgical Team, Kandahar, 2019. She closes the phone immediately, as if someone might see. Dr. Elena Volkov doesn't exist before 2021. No employment records, no publications, no digital footprint. Before that, there was only Valkyrie. Call sign, not a name, a function, chooser of the slain. Her hand moves to the chain around her neck, hidden beneath her scrubs. She touches the ring hanging there, spins it once between thumb and forefinger. An old habit, a reminder. Captain Marcus Volkov, helicopter pilot, killed in action, Helmand Province. 2020. She was operating when the notification came, 16 hours into a mass casualty event. She finished the surgery first. All of them. 18 hours total. Then she screamed, once, loud enough that people 3 tents away heard it. After that, silence. Elena stands, throws away the coffee-soaked napkins, and returns to work. The hospital thinks she's unstable, and maybe they're not completely wrong. But instability and precision aren't opposites. Sometimes they're the same thing, 2 sides of a coin that only spins one way. She mops the corridor outside the ICU, invisible to the doctors rushing past, and she waits for the shift to end. 2:14 in the afternoon. Elena stands in the medication supply room, counting morphine vials for inventory. Her hands move in rhythm, checking labels, logging numbers. Routine work that requires just enough attention to keep her mind occupied, but not enough to stop the memories from creeping in at the edges. The door swings open. A gurney rushes past in the hallway outside. Paramedics shouting. The sharp chemical smell of trauma, blood, and adrenaline mixed with antiseptic. Elena's hand freezes mid-count. The vial in her palm feels suddenly heavier, as if gravity has shifted. She closes her eyes, tries to breathe through it, but the sounds are too familiar. Controlled chaos, urgent voices, the particular timbre of fear wrapped in professional calm. The gurney passes. Silence returns. But the trigger has already fired. She's not in Baltimore anymore. Desert. Desert heat pressing down like a physical weight. Tent walls rippling in hot wind. The smell of dust and fuel and something burning in the distance. A young soldier on the table in front of her, 19 years old, shrapnel through his chest. His name was Cooper. She remembers because he kept apologizing while she operated, saying sorry for bleeding so much, sorry for being trouble. She told him to shut up and save his strength. He laughed. Then the monitors started screaming. Elena opens her eyes. The supply room comes back into focus. Fluorescent lights, linoleum floors, rows of medication in perfect order. Not a tent, not a war zone, safe. She sets down the vial, grips the edge of the counter. Her knuckles go white. Breathe. Count. Ground yourself. Cooper lived. She saved him, sent him home with a scar and a story. That's what matters. But Marcus didn't. She pushes the thought away, forces herself back to the inventory. 11 vials. 12. 13. And numbers help. Structure. Order. Things that make sense. Footsteps in the hallway. Dr. Stevens, moving fast. His voice carries through the open door. We need extra hands in the ER. Multi-car pile up on the expressway. Chen, grab whoever's free. Elena steps toward the door, instinct overriding protocol. Then stops herself. She's not free. She's on probation, not allowed in emergency situations without direct supervision. She returns to counting. 14, 15. But her ears track the commotion. Ambulance sirens growing louder, doors slamming. The organized chaos of a hospital preparing for mass casualties. Her pulse quickens despite herself, adrenaline responding to a call she's not allowed to answer. Someone runs past, a resident, young, panicked. "Where's anesthesia? We need anesthesia now." Elena's jaw clenches. She knows that tone. That particular edge of panic that comes when things are worse than expected and the people in charge aren't sure what to do next. She finishes the count, logs the numbers, closes the cabinet, walks into the hallway. The ER is 30 feet away. She can see through the glass doors. Organized chaos tipping toward just chaos. Too many patients, not enough hands. Not your problem, not your responsibility. She turns away, heads toward the staff break room. Inside, the television still plays news. She pours another cup of bad coffee, sits at the small table. Her hands are steady around the cup, but there's a tightness in her chest that won't release. On screen, a reporter stands in front of a destroyed hospital somewhere overseas. The building is half collapsed, smoke still rising. The ticker at the bottom reads, "Aid workers killed in airstrike." Elena stares at the image, sees herself in that rubble, sees the tent hospital she worked in. The one that got shelled while she was wrist-deep in a thoracotomy. Sees the faces of people she couldn't save because the supplies ran out, or the generators failed, or the bleeding was just too much, too fast. Her phone buzzes, a text from an unknown number. "Still hiding, Valkyrie?" Her blood goes cold. She stares at the screen, reads it again. No one here knows that name. No one should. She deletes the message, blocks the number, sets the phone face down on the table. But her heart is racing now, the careful control she's maintained for 2 years suddenly fragile. Someone knows. Someone found her. The break room door opens. Nurse Patricia enters, sees Elena, hesitates. "Oh, sorry, didn't know anyone was in here." Elena doesn't look up. "It's fine." Patricia moves to the coffee maker, pours a cup. The silence stretches awkward and thick. Then she speaks, voice careful. "That thing in the OR last month, with Dr. Stevens." Elena's shoulders tighten. "What about it?" "You were right. About the bleed. I saw the post-op report." Elena finally looks at her. Patricia's expression is uncertain, like she's not sure if she's allowed to acknowledge the truth. Doesn't matter now. It does, though. Patricia sits across from her, uninvited. "You saved that patient, and you got punished for it. I got punished for insubordination. You got punished for making an attending look bad." Patricia's voice drops lower. "We all know it, and it's not fair." Elena studies her, searches for the angle, the hidden agenda. But Patricia just looks tired and honest. Fair doesn't matter in hospitals. Hierarchy does. Maybe it shouldn't. Elena almost smiles. Almost. Good luck changing that. Patricia sips her coffee, grimaces at the taste. "Where'd you train? Before here?" The question is casual, but Elena feels the weight behind it, the curiosity, the pieces that don't quite fit. Mass General. And before that? Hopkins. And between Hopkins and Mass General? Elena's expression goes neutral, that carefully constructed blankness that gives nothing away. "I took time off." "How much time?" "Enough." Patricia nods slowly, like she's solving a puzzle. "You move like military, the way you lift patients, the way you assess a room when you walk in. My brother's army. I recognize it." Elena stands, carries her cup to the sink. "Your brother's wrong. I didn't say you were military. I said you move like it." Elena rinses the cup, sets it in the dish rack, doesn't turn around. "I need to get back to work." She leaves, before Patricia can respond. Walks quickly. Not running, but close. Her hands push into her pockets, fingers finding the edge of the folded flag she keeps there. A talisman. A reminder. You left that life. You're not Valkyrie anymore. You're just Elena. Quiet, invisible, safe. But the text message burns in her mind. Still hiding. Someone knows. And if someone knows, then the carefully constructed walls she's built around her new life are already starting to crack. She returns to the supply room, closes the door, and leans against it. Breathes, counts. In the distance, sirens wail. The ER is still chaos. People still need help. But Elena Volkov stays where she is, counting morphine vials and pretending the past isn't hunting her down. Ambulance bay doors explode open at 2:47. The sound cuts through the afternoon like a gunshot, sharp and final. Elena is in the hallway, 40 feet away, pushing a cart of clean linens. Her head turns automatically, tracking the source. Paramedics rush through, voices tight with controlled panic. A gurney between them, small body strapped down, too small. A child. 8-year-old male, ejected from vehicle, chest trauma. BP 60/40 and dropping, lost pulse twice en route. Dr. Stevens intercepts them at the ER entrance, already moving, residents scrambling behind him like ducklings. Get him to trauma 2. Start fluids wide open. Someone page cardiothoracic. A resident, young and scared, sprints past. They're in surgery, 20 minutes minimum. We don't have 20 minutes. Stevens' voice rises half an octave, the crack of uncertainty showing through. Prep for chest tube placement, get me. Elena abandons the cart. Her feet move before her brain catches up. Muscle memory overriding protocol. She follows the gurney, staying just outside the treatment room, watching through the window. The boy on the table can't be more than 60 pounds, brown hair matted with blood. His chest rises and falls with the ventilator. But something is wrong. The movement is there, but it's mechanical, disconnected. Air going in, but not going where it needs to. Stevens leans over him, gloved hands assessing. Decreased breath sounds on the right. Get me a... Left. Elena's voice cuts through before she can stop it. Quiet but absolute. Every head turns. Stevens' eyes find her through the window, confusion shifting to anger. Volkov, you're not authorized. It's the left side, not the right. She pushes. It's through the door, hands already reaching for gloves from the wall dispenser. Tracheal deviation, jugular venous distension, tension pneumothorax, left hemithorax. Stevens looks back at the boy, his confidence fracturing. We need imaging to confirm. You need a needle, now. In 90 seconds, his heart stops. The room freezes. Everyone looking at Stevens, then Elena, then back. The monitor beeps steady but thin. The BP number dropping. 58/39. Stevens hesitates. That fatal pause between knowing something is wrong and knowing what to do about it. Elena steps to the table. Her voice drops, calm as flat water. Let me do this, or you lose him. The residents stare. Stevens' jaw works, pride fighting with reality. Then he steps back, nods once. Elena's hands move, no wasted motion. She palpates the second intercostal space, mid-clavicular line, left side. Finds the landmark. A nurse puts a 14-gauge needle in her palm without being asked. Elena doesn't look at it, doesn't check it, just positions and inserts in one smooth motion. The hiss of escaping air is immediate, loud, like a tire deflating. Decompression. The boy's chest movement changes. Real breath now, not just mechanical rise and fall. The monitor climbs. 62/41. 68/45. Elena withdraws the needle. Steps back. Chest tube. 5th intercostal space. Mid-axillary line. He'll need a CT for additional injuries. Probable pulmonary contusion. Stevens stares at her. Everyone stares at her. She strips off the gloves, drops them in the bin. Someone should do that now. A resident scrambles forward, prepping the chest tube kit. Stevens still hasn't moved, his face caught between gratitude and something darker. Embarrassment. Inadequacy. Elena walks toward the door. Dr. Chen is standing there, arms crossed, expression unreadable. That was a combat medicine technique. She doesn't stop. That was basic trauma management. Needle decompression without imaging, without hesitation. He follows her into the hallway. Most civilian doctors won't do that. Too much liability. Most civilian doctors don't watch people die from caution. She keeps walking. Chen matches her pace. Where did you learn to move like that? Medical school. Same as you. No, that wasn't medical school. He stops her with a hand on her arm, gentle but firm. That was field experience. Real-time, high stakes, no backup field experience. Elena pulls her arm free. I don't know what you think you saw. I saw someone who's done this before. A lot. Under worse conditions. His voice softens. I saw someone who didn't have to think. Just acted. She turns away. The boy is alive. That's all that matters. Elena. The use of her first name stops her. She looks back. Chen's expression is careful, probing. You just saved a kid's life with a technique most ER docs are terrified to use. And you did it like you were checking a blood pressure. That's not normal. Maybe I'm just good under pressure. Maybe. He doesn't look convinced. Or maybe he's been under that kind of pressure so many times, it doesn't register anymore. She holds his gaze, gives nothing. I need to get back to work. You're not going to get in trouble for this. Stevens knows you saved that patient. Stevens knows I made him look incompetent, again. Chen almost smiles. Well, you did. Elena walks away. Behind her, she hears the ER continuing its organized chaos. The boy will live. She knows because she's done this enough times to recognize a save. Clean intervention, immediate response, no complications. But she also knows what comes next. Attention, questions. People looking too closely at the woman who shouldn't have that kind of skill set. She returns to the linen cart, abandoned in the hallway, starts pushing it toward the elevators. Her hands are steady, but her mind is racing. That was a mistake. Drawing attention, breaking cover. She should have stayed silent, let Stevens handle it, even if the boy died. That's the cost of hiding. Other people's lives weighed against your own safety. But she couldn't, didn't, wouldn't. Some instincts run too deep to ignore. The elevator doors open. Nurse Patricia is inside, phone in hand. She looks up, sees Elena, and her expression shifts. Complicated. That was incredible, what you just did. Elena steps inside, presses the button for the 4th floor. I was just helping. You were just saving a life everyone else was about to lose. Patricia's fingers move across her phone screen. People are already talking about it. Someone recorded it. Elena's stomach drops. Recorded? Just the audio, but still. Patricia pockets her phone, looks at Elena with new eyes. Who are you, really? The elevator climbs. Elena watches the numbers change. 2, 3. Just a doctor. No, you're something else. Patricia's voice is quiet, almost reverent. Something we don't have here. The doors open on 4. Elena steps out, doesn't look back. You're wrong. But she knows Patricia isn't. And worse, she knows that everyone else is starting to figure it out too. The quiet life she built is unraveling. One save at a time. The hospital administrator's office smells like old coffee and desperation. Elena sits across from David Graves, hands folded in her lap, expression carefully neutral. 4:47 in the afternoon. The light through the window is starting to fade, casting long shadows across the cluttered desk. Graves leans back in his chair, fingers steepled, the posture of a man who thinks he holds power. Dr. Volkov, we need to talk about what happened today. Elena says nothing, waiting. You violated protocol, again. He pulls a file from his desk, flips it open. You're on probationary status. Limited patient contact. Absolutely. No emergency interventions without direct authorization from an attending. The boy would have died. That's not the point. That's the only point that matters. Graves closes the file, harder than necessary. Your personnel record reads like a liability nightmare. Insubordination, emotional outbursts, unauthorized procedures, and now this. Elena's jaw tightens, but her voice stays level. The child is alive. His name is Michael Chen, no relation to our Dr. Chen. He has 2 parents and a sister who will see him again because I didn't wait for permission. You're becoming a problem, Dr. Volkov. I'm becoming effective. There's a difference. Graves opens his mouth to respond, but the door swings open. No knock, no announcement. A man enters. Late 50s, gray at the temples, suit pressed sharp enough to cut. Federal bearing in every line of his body. He moves like someone used to being obeyed. Graves stands, indignant. Excuse me, this is a private meeting. The man pulls credentials from his jacket, flips them open. The badge catches light. FBI. Agent Morrison. I need to speak with Dr. Volkov, immediately. Elena's posture changes. Micro adjustments, invisible to anyone not trained to see them. Her weight shifts, balance centering. Combat ready. Graves sputters. This is highly irregular. I'm in the middle of a disciplinary. I don't care. Morrison's eyes lock on Elena, studying, measuring. We can do this here or somewhere more private. Your choice, doctor. Elena stands slowly. Here is fine. Morrison nods, then looks at Graves. Leave. This is my office. Leave. Now. Something in Morrison's voice makes it clear this isn't a request. Graves gathers his file, mutters something about protocols, and exits. The door closes with a soft click. Silence fills the space. Morrison and Elena, 10 feet apart, assessing each other. Morrison speaks first. Kandahar, 2019. Forward operating base Sharana, Elena's. As face doesn't change, but she stops breathing for exactly 1 second, then resumes, controlled. I don't know what you're talking about. Yes, you do. He pulls out a tablet, taps the screen, turns it toward her. A photograph, desert landscape, surgical tent, 6 people in blood-stained scrubs. Elena in the center, younger, hair tied back, eyes fierce. Her expression remains neutral, but her fingers twitch, just once. Morrison zooms in on her face. Captain Elena Rains. JSOC surgical attachment. Tier 1 clearance. You operated on Senator Kirkland's son. Marine Corps Lieutenant. Improvised explosive device. Traumatic amputation of left leg below knee. Abdominal evisceration. Liver laceration. Every other surgeon said he was unsalvageable. Elena's eyes stay on the photo. She doesn't speak. You kept him alive for 6 hours, through 2 firefights and a mortar attack, until medevac arrived. Morrison sets the tablet on the desk. They gave you a call sign, Valkyrie. The word lands like a physical blow. Elena's hands close into fists, then deliberately relax. I left that life. That life is looking for you. He slides a folder across the desk. Classified markings on the cover. Elena doesn't touch it. I'm not interested. CIA Director's daughter, Megan Hatcher, 19 years old. Targeted kidnapping overseas, Ankara. Rescued 40 minutes ago, but she's critical. Shrapnel wounds, internal bleeding. They're flying her to Walter Reed. Elena keeps her hands at her sides. Then get her a surgeon. We have one. Dr. Hassan Karim. You trained him. Her eyes close, just for a second. Hassan. Syria, 2018. She taught him how to operate under fire, how to make decisions when every option is bad. Hassan is excellent. He doesn't need me. Morrison steps closer. He asked for you, specifically. Said if Valkyrie doesn't operate, the girl dies. Those were his exact words. He's wrong. Is he? Morrison's voice softens, just slightly. Or are you just afraid? Elena's eyes snap open, ice cold. I'm not afraid. I'm retired. You can't retire from what you are. Watch me. Morrison picks up the folder, holds it between them. 19 years old. Same age Marcus was when you met him. Same age you were when you decided to become a surgeon. Elena's hand moves to the chain around her neck, touches the ring. The gesture is automatic, unconscious. She catches herself, drops her hand. Don't. Don't what? Tell you the truth? Morrison's expression hardens. You've been hiding here for 2 years, playing janitor, pretending you're someone else. But today, you proved you can't hide from what you are. What I am is done. You saved a kid's life 2 hours ago. That's not done. That's just getting started. Elena turns away, looks out the window. The city beyond. Traffic moving. People living normal lives, unaware of the weight pressing down on this room. If I do this, they'll know. Everyone will know. Morrison moves beside her, follows her gaze. They already know. That video from the ER has been forwarded to 16 different agencies. Facial recognition flagged you in 3 databases. Your cover is blown, Dr. Volkov. She closes her eyes. The careful life she built, the quiet anonymity, all of it crumbling. What happens if I say no? A girl dies, and you live with that. I've lived with worse. Have you? Morrison's voice is quiet now, almost gentle. Or have you just been surviving? The question cuts deeper than she expects. Elena opens her eyes, looks at the folder in his hands. How long do I have? Helicopters on the roof, wheels up in 8 minutes. That's not enough time. It's all the time there is. He extends the folder. You coming or not? Elena stares at it. The file that represents everything she's been running from, the life she thought she'd left behind, the name she swore she'd never answer. To again, Valkyrie. She takes the folder. Tell them I'm coming. Morrison nods, already moving toward the door. Elena follows, her stride changing. No longer the defeated janitor shuffling through hallways. Now she moves with purpose, with certainty. The transformation is immediate. Shoulders back, eyes forward. Every step deliberate. They pass nurses in the hallway. Eyes follow. Whispers start. Elena doesn't acknowledge them. She's already gone, mentally, already in the OR, already planning the surgery she hasn't seen yet. The elevator ride is silent. Morrison watches her, sees the shift, the civilian mask falling away. You're different already. I'm focused. You're Valkyrie. She doesn't deny it. Can't, because he's right. The rooftop access door opens to rotor wash and jet fuel. A black helicopter, military grade, rotors already spinning. The pilot sees her, gives a sharp nod. Elena climbs aboard. The door closes. The city drops away beneath them. She opens the folder. Medical reports, CT scans, vitals. Her eyes move fast, processing. Liver laceration, grade 4. Splenic rupture. Possible vascular involvement. Blood pressure unstable. This is bad. Worse than Morrison implied. But she's done worse. The helicopter cuts through twilight. Elena's hands rest on her knees, steady. She's not Dr. Volkov anymore. She's Valkyrie. And Valkyrie doesn't lose. Walter Reed National Military Medical Center materializes through the twilight. Floodlights illuminate the landing pad. Armed guards positioned at intervals. Black SUVs forming a perimeter. This isn't a hospital receiving a patient. This is a fortress, protecting an asset. The helicopter touches down. Elena's out before the skids fully settle. Ducking under rotor wash, folder pressed against her chest. The noise is overwhelming, but familiar. The kind of chaos that used to be her baseline. A figure approaches through the prop blast. Tall, lean. Surgical scrubs already speckled with blood. The face registers half a second before the name. Hassan Karim. He's older. Gray threading through his hair at the temples. A scar cutting through his left eyebrow that wasn't there before. But his eyes are the same. Sharp, desperate, seeking. Valkyrie. The name hits different coming from him. Not an accusation or a question. A plea. Elena stops 3 feet away. They stare at each other across 2 years and a lifetime of shared trauma. Hassan. I'm sorry. I had no choice. Where's the patient? No time for reunions. No space for sentiment. He knows this, accepts it, hands her a tablet without another word. Vitals scroll across the screen. Heart rate 132. Blood pressure 84/51. Sustained only by pressors. Hemoglobin dropping despite transfusion. The CT images show exactly what she feared. Liver laceration, extending to the inferior vena cava. Splenic rupture. Free fluid throughout the abdomen. How many units? 14. She's still bleeding. Vascular damage. Probable. But we can't stabilize her long enough for angiography. Elena swipes through the images, her mind already mapping the surgery. Entry point, exposure, vascular control, damage assessment. The steps line up like muscle memory. You're going in blind. Hassan nods. We have to, but I can't do this alone. You trained under the best. You don't need me. I trained under you. His voice cracks slightly. And yeah, I do. Behind them, the sound of vehicles. Multiple engines controlled urgency. Elena turns. 3 black SUVs arriving in formation, too precise to be civilian. David Graves emerges from a sedan, 20 yards back, red-faced and out of breath. Volkov, you can't just commandeer federal resources without authorization. The lead SUV's rear door opens. A man steps out. Tall, gray hair immaculate despite the hour. Suit that costs more than most people's monthly salary, but it's the bearing that gives him away, the way everyone else's posture shifts in his presence, unconscious deference to authority. Director William Hatcher, Central Intelligence Agency. The entire landing pad goes quiet. Even Graves stops mid-sentence. Hatcher walks directly to Elena. No preamble, no introduction. His eyes are red-rimmed, the only crack in an otherwise impenetrable facade. You're Valkyrie. It's not a question. It's confirmation of something he already knows. Elena meets his gaze. I was. My daughter is dying. His voice is level, but there's an edge underneath, a father's terror wrapped in a director's control. They tell me you can save her. I can try. Not good enough. He steps closer. Can you save her or not? Elena holds his stare, doesn't blink, doesn't flinch. Get out of my way and find out. Silence expands. Hatcher studies her, measuring something beyond medical competence. Character. Resolve. The willingness to carry the weight he's about to place on her shoulders. He nods once, sharp, final, then turns to a security detail. Clear the path. Whatever she needs, she gets. No questions. Elena moves past him. Hassan falls into step beside her. Behind them, Graves starts to protest, but Morrison appears from somewhere, cuts him off with a hand and a look. The hospital interior is organized chaos. Staff moving with military precision, equipment staged, blood products ready. Someone knew she was coming. Someone prepared. They reach the OR suite. Elena stops at the scrub sink, strips off her jacket. Underneath, she's still wearing the cheap scrubs from St. Catherine's. They'll have to do. A surgical nurse appears at her elbow. Dr. Volkov, we have fresh scrubs. No time, glove me. The nurse's eyes widen, but she doesn't argue. Elena scrubs fast, efficient, the ritual automatic after thousands of repetitions. Hassan scrubs beside her, silent. Talk to me. Elena doesn't look at him. Vitals now. BP 80/48, HR 140, temperature dropping. We've got maybe 30 minutes before she's unsalvageable. Then we work fast. They push through into the OR. The patient is already prepped, draped, anesthesiologist at the head, managing pressors and transfusion. Elena's eyes go to the monitors first. Numbers worse than the tablet showed. This girl is circling the drain. The surgical team looks up. 5 faces she doesn't know, all waiting, all uncertain. Elena positions herself at the table. I'm Dr. Volkov. If anyone in this room doubts me, leave now. Because I don't have time for hesitation. No one moves. Good. She extends her hand. Scalpel. The nurse slaps it into her palm. Elena looks down at the draped abdomen, young skin marked for incision. 19 years old. Megan Hatcher. A name. A person. Someone's daughter. But right now, she's just a body. Just anatomy. Just a problem to solve. Elena cuts. Clean midline incision, sharp and deep. The abdomen opens and blood wells up immediately, dark and fast. Suction. The field clears. She extends the incision, exposes the peritoneum. More blood. Too much blood. Lap pads. Get me exposure. Hassan's hands move in sync with hers, tacking the quadrants, trying to isolate the source. But the bleeding is everywhere, diffuse. We need to find the major vessel. Elena's voice is calm, but her hands are moving faster now. Check the porta hepatis. Hassan retracts. Elena explores, fingers searching through blood and tissue. There, the liver edge, lacerated deeply, and beneath it, IVC injury, partial thickness. She looks at the anesthesiologist. How much blood do we have? 8 units left. Get more. And keep her pressure up. I need time. The anesthesiologist nods, adjusts the infusion. The monitor beeps faster. HR climbing. BP dropping. Elena isolates the vena cava, assesses the damage. A 2-centimeter tear. Venous blood pumping through. Rough. She needs vascular control. But one wrong move and the tear extends and this girl bleeds out on the table. Pringle maneuver. Clamp the hepatic pedicle. Hassan positions the clamp. Squeezes. The liver inflow stops. They have 20 minutes before ischemic damage becomes irreversible. Elena works. Sutures the cava tear, each stitch precise, tension perfect. Blood obscures the field. She suctions, places another stitch, suctions again. The world narrows to this. Just anatomy. Just technique. BP 60/30. I'm almost there. Another stitch. Another. The tear closes. She tests it gently. Holds. Release the clamp. Hassan releases. Blood flow returns. The liver pinks up. The tear holds. BP rising. 72/45. Elena doesn't celebrate. Moves immediately to the spleen. Shattered. Unsalvageable. Splenectomy. Ligate the splenic artery first. They work together. Old rhythm returning. Hassan knows her moves before she makes them. Anticipates her needs. This is what training does. Creates a shared language beyond words. 10 minutes later, the spleen is out. Bleeding controlled. BP stabilizing. Elena surveys the abdomen. Checks every quadrant. Liver, kidneys, bowel, diaphragm. All clear. Close her up. She steps back, strips off gloves. The surgical team continues, closing in layers. Elena watches, making sure. Always making sure. Hassan moves beside her, pulls down his mask. His eyes are wet. Thank you. Elena doesn't respond. Just watches the monitors. HR decreasing. BP holding. This girl will live. Valkyrie doesn't lose. The waiting room outside the ICU smells like industrial cleaner and anxiety. Elena sits alone on a plastic chair, still in surgical scrubs, blood-dried brown on her forearms. She hasn't washed yet, hasn't moved since she walked out of the OR 20 minutes ago. Her hands rest on her knees, steady, always steady. The door opens. Hassan enters, 2 cups of coffee. He sits beside her without asking, extends 1 cup. She takes it but doesn't drink. She's stable. Post-op vitals are good. Elena nods. Expected, but still a relief. Thank you for coming. Hassan's voice is quiet. I know what it cost you. You don't know anything. I know you disappeared after Marcus died. I know you buried yourself somewhere and tried to pretend Valkyrie never existed. He sips his coffee, grimaces. I know because I tried the same thing. Elena looks at him, really looks. The scar through his eyebrow, the lines around his eyes, the weight he carries differently now. Syria? Aleppo, 2021. Field hospital got hit. I was the only surgeon. 47 casualties in 6 hours. His hands tighten around the cup. I lost 16 of them. That's not a bad ratio for those conditions. Tell that to the 16 families. Elena says nothing. There's nothing to say. They both know the math. They both know the cost. I quit after that. Chesson stares at the far wall. Came back stateside. Took a position here. Safe. Controlled. No mortars. No mass casualties. He looks at her. But I still see them. Every night. The ones I couldn't save. That doesn't go away. I know. But operating helps. Saving the ones I can. He pauses. Why did you stop? Elena's hand moves to the ring on her chain. Spins it once. Twice. Because I couldn't save him. Marcus. I was operating when the notification came. 18 hours into a mass casualty event. They told me he was gone, and I just kept working. Her voice is flat, factual. Finished every surgery. Closed every patient. Then I walked outside and I couldn't breathe. Hassan waits. Lets the silence hold space. I couldn't understand it. Elena's fingers still on the ring. I'd saved dozens of people that day. Dozens. But I couldn't save him. And if I couldn't save him, the one person who mattered most. And what was the point of any of it? The point. Point is them. Hassan gestures toward the ICU. Every person after him. You don't get to choose who lives just because you couldn't save the one you loved. Don't I? Her eyes meet his. I chose to leave. I chose to hide. I chose to stop being Valkyrie. And tonight, you chose to come back. Tonight, I was forced back. No. Hassan sets down his coffee. You were given a choice. You could have said no. Stayed hidden. Let someone else try. He leans forward. But you didn't. Because you're not someone who walks away when a life is on the line. I walked away from hundreds of lives when I left. You walked away from the life that killed your husband. That's different. The words hit like a scalpel. Clean, precise, true. Elena closes her eyes. He wanted me to stay. After his first deployment, he said we should both get out. Go somewhere quiet. Be normal. She opens her eyes. I told him we were needed, that we were making a difference. I convinced him to re-up. Elena? He died because I wanted to keep saving people. The irony is pretty obvious. Hassan's hand covers hers, warm, solid. Marcus died because war is chaos and helicopters crash, and sometimes good people die for no reason at all. That's not your fault. Logically, I know that. But you don't feel it. No. They sit in silence. The ICU machines beep steadily through the door. Regular, rhythmic, living. That girl in there. Hassan's voice is gentle. Megan, she's alive because you didn't let grief stop your hands. That's not weakness, that's strength. It doesn't feel like strength. It never does. The door opens again. Director Hatcher, still in his suit, still immaculate, but his eyes are different now. Softer, human. Hassan stands. I'll give you privacy. He leaves. Hatcher approaches slowly, like he's not sure he's allowed. Elena stands, professional courtesy overriding exhaustion. She's stable, Elena says, before he can ask. The next 48 hours are critical, but if she makes it through without complications, she'll recover fully. Can I see her? ICU visiting hours. Dr. Volkov. His voice cracks slightly. Can I see my daughter? Elena nods toward the door. 5 minutes. Don't touch anything connected to a tube. He moves past her, pauses. Thank you. For her life. Thank me in 48 hours. He almost smiles, then disappears into the ICU. Elena sits back down, picks up the coffee. It's cold now, but she drinks it anyway. Caffeine and bitterness. Her phone buzzes. A text from an unknown number. You can't hide anymore, Valkyrie. Different number than before. Same message. Same truth. She deletes it, but she knows it's right. Footsteps. Morrison approaches, tablet in hand. He sits where Hassan was. Facial recognition confirmed your identity to 6 intelligence agencies. Your cover at St. Catherine's is completely blown. He shows her the tablet. News articles already appearing. Anonymous sources are leaking. By morning, everyone will know who you are. Elena stares at the screen. Headlines. Mystery surgeon saves CIA director's daughter. Former special operations doctor emerges from hiding. Someone got a photo of her on the roof, climbing into the helicopter. The image is grainy, but clear enough. I can't go back. No, you can't. Morrison takes the tablet back, but you can go forward. To what? Director Hatcher is offering you a position. Consultant for Federal Medical Crisis Response. High-level clearance. Operational support for situations like this. I'm not interested in working for the CIA. You'd be working with them, not for them. Independent contractor. You maintain autonomy. He leans back. And you'd be doing what you're best at. Saving lives that no one else can save. Elena's head falls back against the wall. Stares at the ceiling tiles, counting them. 64 visible from this angle. I came to Baltimore to disappear. And you did, for 2 years. But disappearing isn't the same as living. It was safer. Safer for who? You or the people who needed Valkyrie? The question sits heavy. Elena doesn't answer because she doesn't have one. Morrison stands. Think about it. No pressure. But that girl in there is alive because you stopped hiding. That matters. He leaves. Elena sits alone again. The ICU door opens. Hatcher emerges, eyes red. He sees her, nods once. Then walks away surrounded by security. Elena's phone buzzes again. This time it's a legitimate number. St. Catherine's Hospital. She answers. Volkov. Dr. Chen's voice. Elena, where are you? Walter Reed. Long story. I'm seeing some very interesting news alerts. Want to explain? Elena almost laughs. Almost. Not particularly. Fair enough, a pause. For what it's worth, I'm not surprised. You were always too good to be just a janitor. Chen, the boy from today, Michael. He's awake. Asking for the doctor who saved him. Another pause. His parents want to thank you. Elena's throat tightens. I was just doing my job. Yeah, the job you were always meant to do. His voice softens. Come back when you're ready. You have a place here, a real one. Not scrubbing bedpans. I'll think about it. That's all I ask. He hangs up. Elena sits in the empty waiting room, phone in hand, coffee cup empty beside her. 2 years of hiding. 2 years of running from a name and a life that defined her. And in one night, it all came back. She looks at her hands. Still steady. Still capable. Still the hands of a surgeon who doesn't quit. Maybe Hassan was right. Maybe the point isn't the ones you lose. Maybe it's the ones you save. She stands. Time to wash the blood off and figure out what comes next. Valkyrie is back, whether she wants to be or not. St. Catherine's Medical Center looks different in morning light. Or maybe Elena is different. She walks through the main entrance at 7 a.m., 3 days after Walter Reed, and the entire lobby goes quiet. Staff stop mid-conversation. Patients in wheelchairs turn to look. A resident drops his coffee. The silence breaks into whispers. Elena keeps walking, eyes forward, but she hears fragments. That's her, the one from the news. Valkyrie. The name follows her like a shadow. She reaches the elevator. Nurse Patricia stands inside, alone. Their eyes meet. Patricia's expression shifts through surprise, uncertainty, then something like awe. Dr. Volkov. Patricia. The doors close. They rise in silence. 3rd floor. 4th. Patricia finally speaks. I owe you an apology. Elena looks at her. For what? For believing the rumors. For thinking you were unstable. Patricia's voice drops. I didn't know who you were, what you've done. I'm the same person I was last week. No, you're not. Patricia shakes her head. Last week, you were someone hiding. Now you're someone who saved the CIA director's daughter on national news. The elevator opens on 5. Elena steps out. Patricia follows. Everyone knows now about your background, the military service, the operations. Patricia keeps pace. Dr. Stevens called an emergency staff meeting, then dropping all disciplinary actions. Full reinstatement with privileges. Elena stops at the nurse's station. Her old locker has been moved. Her name now appears on the surgical staff board. Dr. Elena Volkov, attending surgeon, trauma. I didn't ask for that. You didn't have to. Patricia hands her a new ID badge, clean photo, proper credentials. You earned it, about 300 times over, apparently. Elena takes the badge, clips it to her scrubs. The weight feels strange, official, permanent. Dr. Chen emerges from a patient room, sees her, smiles wide. The prodigal surgeon returns. I was only gone 3 days. 3 very eventful days. He walks with her toward the conference room. The board met yesterday. Emergency session. They want you to lead a new trauma response protocol. Chen, before you say no, just listen. He stops her outside the conference room. Through the window, she can see doctors gathered, waiting. We're implementing changes, real ones. Surgical authority based on competence, not seniority. Rapid response teams with autonomy to act. Evidence-based intervention without waiting for committee approval. That'll never work in a hospital bureaucracy. It will if you lead it. His expression turned serious. You operated under fire. You made decisions in seconds that most surgeons agonize over for hours. That's what we need here. What you need is institutional reform, not one surgeon. We need both, and you're the catalyst. He opens the door. 5 minutes, just hear them out. The conference room falls silent as Elena enters. 15 faces turn toward her. Attendings, residents, administrators. Dr. Stevens sits at the head of the table looking uncomfortable. Elena remains standing. Dr. Chen said you wanted to talk. Stevens clears his throat. Dr. Volkov, first, I want to apologize, formally, on behalf of the department and myself personally. He looks directly at her. You were right about the appendectomy patient. You were right about the boy with the pneumothorax. And I punished you for being right because my ego couldn't handle being wrong. The room is dead quiet. This kind of admission doesn't happen, not from senior attendings. Stevens continues. Your personnel file is being amended. All disciplinary actions removed. You're being offered a position as attending trauma surgeon with full authority. Elena's jaw tightens. I don't want special treatment. This isn't special treatment. This is correcting an injustice. Stevens stands. You're one of the most qualified surgeons in this building. Probably the most qualified. And we've had you emptying bedpans. A resident speaks up, young woman in the back. Dr. Volkov, I watched the video from the ER. The needle decompression. I've read about that procedure, but I've never seen anyone do it without imaging confirmation. Combat medicine requires different risk calculations. Can you teach us? The resident leans forward. Not just the procedures, the decision-making. How to act when there's no time to think. Elena looks around the room. Eager faces. People who want to learn, want to be better. That kind of training isn't standard curriculum. Dr. Chen speaks from the doorway. So we make it standard. The Volkov Protocol. Trauma response training based on your experience. That's not, it's exactly what we need. Stevens pulls out a folder, slides it across the table. We've drafted a proposal. 6-month pilot program. You lead simulation training, protocol development, and active trauma response. Your methods, your authority. Elena picks up the folder, scans the contents. It's comprehensive, detailed. Someone put serious thought into this. This will disrupt every power structure in the department. Good. Stevens almost smiles. Those structures nearly killed a patient last month because I was too proud to listen. Time for disruption. Elena closes the folder, looks at each face. These people are serious. They want change, real change. I have conditions. Name them. No interference during active cases. If I make a call, it stands. Questions come after, not during. Stevens nods. Agreed. Direct access to the OR. No scheduling delays for political reasons. Done. And everyone trains, attendings, residents, nurses. No exceptions based on seniority. Stevens hesitates, then nods. Agreed. Elena sets down the folder. I'll do it. 6-month trial. We'll evaluate after that. The room releases a collective breath. Several people smile. The meeting ends. People approach her. Introductions and congratulations. Congratulations. Elena accepts them with professional courtesy, but inside she's still adjusting. 3 days ago, she was a ghost. Now, she's a department head. Patricia catches her in the hallway after. There's someone here to see you. The boy from the ER, Michael, and his parents. Elena follows her to a patient room. Inside, a young boy sits up in bed, chest tube removed, color good. His parents stand beside him, faces exhausted but grateful. The mother sees Elena. Her eyes immediately wet. Dr. Volkov. Mrs. Chen, you saved our son's life. The words come out broken. The other doctors said if you hadn't been there, if you hadn't known what to do. I was there. That's what matters. The father extends his hand. Elena shakes it. His grip is firm, trembling slightly. Thank you. We don't have better words. Just thank you. Michael looks at her, eyes bright. You're the doctor everyone's talking about. The one who was a soldier. I was a surgeon. In the military, there's a difference. But you saved people in wars. I tried to. And now, you save people here. Elena looks at this boy, 8 years old, alive because she couldn't walk away. Yes, now I save people here. The mother touches her arm. Whenever you need anything, we owe you everything. Elena shakes her head gently. You don't owe me anything. Just let him grow up. Be a good kid. That's payment enough. They talk for a few more minutes, then Elena excuses herself. Work to do, protocols to write, a department to reshape. She walks through the hospital corridors, and this time people don't whisper. They nod. Respectful, acknowledging. Dr. Volkov, Valkyrie, the surgeon who came back. Elena reaches her new office, actual office, with a desk and window, her name on the door. She sits, looks out at the city, Baltimore, the place she came to hide. Now it's the place she'll rebuild. Her phone buzzes. Director Hatcher. Megan awake, asking for you. H. Elena tights back. Tomorrow. Give her time. V. She sets the phone down, opens the protocol folder, starts reading, making notes, planning. This is who she is, not the broken widow hiding from her past, not the untouchable soldier operating in war zones. Dr. Elena Volkov, surgeon, teacher, someone who refuses to quit. Valkyrie, still choosing who lives. 6 months later, St. Catherine's Medical Center, renovated trauma wing. The changes are visible immediately. New equipment, organized bays. Simulation labs with state-of-the-art mannequins. The walls display protocol charts, decision trees, trauma response algorithms, all bearing the same header, the Volkov protocol. Elena stands in the simulation lab, watching a team of residents work through a mass casualty scenario. 4 mannequins, multiple injuries, limited resources. The residents move quickly, but efficiently, triaging, prioritizing, executing. Dr. Chen observes beside her. They're getting better. They're getting faster. That's not always the same thing. You're a tough instructor. I'm an honest one. Elena watches a resident hesitate over a difficult airway. Speed, without precision, kills people. The resident chooses cricothyrotomy. Fast, clean. The mannequin's stats stabilize. Elena nods. Better. The simulation ends. The residents gather for debrief. Elena doesn't coddle them, points out mistakes, explains better choices, demonstrates techniques. But there's no cruelty in it, just clarity. A young resident, the same one from the conference room 6 months ago, approaches after. Dr. Volkov, I'm rotating to emergency medicine next month. Can I observe your shifts? If you can keep up. The resident grins. I'll try. Elena's office has become functional rather than decorative. Medical journals stacked on every surface, trauma case studies pinned to boards, a coffee maker that runs constantly. The window looks out over the city, and she finds herself. We're staring out at more than she expected. A knock. Nurse Patricia enters with a folder. Post-op reports from yesterday. All stable. Elena takes them, scans quickly. 3 major traumas in 1 shift. All successful outcomes. How's the department morale? Patricia smiles. High, really high. People actually want to work trauma now. We've had transfer requests from other hospitals. Because of the protocol? Because of you. Patricia sits. You changed how this place operates. Not just procedures. Culture. Elena sets down the folder. It's not about me. It is, though. You showed everyone that competence matters more than hierarchy. That patients come first. Always. Patricia pauses. That's revolutionary in a hospital. It shouldn't be. But it is. Another knock. Dr. Stevens. He looks different too. Less defensive, more collaborative. The power dynamic shifted, and he adapted instead of resisting. Volkov. Got a minute? Always. Stevens enters, closes the door. The board met this morning. They want to make the protocol permanent, expand it to all departments, not just trauma. Elena leans back. That's ambitious. That's necessary. Mortality rates are down 18% since we implemented your methods. Patient satisfaction up. Staff retention up. He hands her a document. They want you as Director of Emergency and Trauma Services. Elena reads the offer. It's substantial. Authority, resources. Full administrative support. I'm a surgeon, not an administrator. You're both. When are you admitted or not? Stephen sits. 6 months ago, I would have fought this. Would have seen it as a threat. He meets her eyes. Now I see it as the best decision this hospital could make. What changed? I watched you save lives I would have lost. Watched you teach residents things I couldn't. Watched you do what I thought I was doing, but better. He smiles slightly. Ego is expensive. I can't afford it anymore. Elena considers. Director position means less time in the OR, more time in meetings. But it also means broader impact. Systemic change instead of individual saves. I need to think about it. Take your time. The offer stands. He leaves. Elena sits with the document, weighing options, calculating costs. Her phone rings. Director Hatcher. Dr. Volkov. Director. Megan's being discharged today. Full recovery. Wanted to let you know. That's excellent news. She wants to see you. If you have time. Elena checks her watch. Afternoon rounds in 2 hours. I can come now. I'll send a car. Walter Weed feels less intimidating in daylight. Elena walks through familiar corridors to Megan's room. The girl is dressed in civilian clothes. Color healthy. Moving without pain. 19 years old and alive. Megan sees her, smiles wide. Dr. Volkov. Megan, you look good. I feel good. Finally. She gestures to the chair. Sit, please. Elena sits. Hatcher stands by the window, giving no space but staying close. I wanted to thank you properly, when I was coherent. Megan's hand unconsciously touches her abdomen, where the scar lives beneath her shirt. Dad told me what you did, how close it was. You're alive. That's all that matters. He also told me about your husband, about why you left. Megan's voice softens. I'm sorry. Elena's hand moves to the ring on her chain. Old habit. Thank you. Can I ask you something? Why did you come back? After 2 years of hiding, why risk everything for someone you didn't know? Elena considers the question, the real answer, not the easy one. Because hiding didn't make the need go away. People still got hurt, still needed help, and I realized that walking away from grief doesn't honor the people we lost. Using what they taught us does. Megan nods slowly, understanding. Your husband would be proud of you. I hope so. Hatcher approaches, extends his hand. Elena. Shakes it. The consulting position is still open, if you're interested. I'm considering it. Part-time. I won't leave St. Catherine's. Understood. We work around your schedule. They talk logistics briefly. Then Elena excuses herself. Work waiting. Always work waiting. She returns to St. Catherine's as the sun sets. The hospital glows in twilight, windows lit, life continuing inside. She thinks about the offer. Director position, more responsibility. Less direct patient care, but broader impact. Her phone buzzes. A text from Hassan. Dinner next week? Want to discuss a joint training program? She replies, yes, send details. The trauma bay doors open, ambulance arriving. Elena's instincts fire. She moves toward the sound, old reflexes taking over. The paramedics wheel in a patient. Car accident, critical. The team mobilizes, but they look to her, waiting for direction. Elena steps forward. Talk to me. They brief her. Multiple injuries, unstable vitals, needs immediate intervention. Elena assesses quickly, makes the call. OR2, now. Chen, you're with me. They move like water, trained, confident. The protocol in action. In the OR, Elena operates with the same precision she always has. Steady hands, clear decisions. The rhythm of surgery, the meditation of saving lives. This is who she is. Not despite the loss, but because of it. Marcus taught her that competence matters, that showing up matters. That refusing to quit when everyone else does makes the difference between life and death. The surgery succeeds. Another save, another life continued. Elena scrubs out, exhausted but satisfied. Dr. Chen joins her at the sink. You're staying, right? Taking the director position? Elena rinses her hands, watches the water run clear. Yeah, I'm staying. Good. We need you. You need the protocol. I'm just the person who implemented it. You're more than that. You're the person who proved it works. Chen dries his hands. You're Valkyrie. Elena looks at him. The name doesn't sting anymore. Doesn't feel like a weight. It feels like an identity. One she's finally accepting. Yeah, I guess I am. She changes into civilian clothes, walks through the hospital one more time before leaving. Staff nod as she passes, respectful, grateful. She built something here, something lasting. Outside, the city moves. Traffic and lights and people living their lives, unaware of the battles fought inside these walls. The lives saved, the deaths prevented. Elena reaches her car, pauses, looks back at the building. This is home now, not the apartment she sleeps in. This hospital, this work, these people who trust her to lead them. She gets in the car, drives through Baltimore streets. Past the neighborhoods she walked when she first arrived, broken and hiding. Past the coffee shop where she sat alone, trying to forget. She's not that person anymore. She's Dr. Elena Volkov, Director of Emergency and Trauma Services, Consultant for Federal Medical Crisis Response, Teacher, Surgeon, Valkyrie. The woman who came back from grief and turned loss into legacy. Her phone buzzes. Unknown number. She tenses, expecting another threat, but it's different this time. Lieutenant Cooper here. Heard Valkyrie is back. The guys from Kandahar want to say thanks. You saved a lot of us. Glad you're saving people again. Elena stares at the message, reads it twice, then types back. Thank you. It's good to be back. She drives home. A ring on her chain catches streetlight. She touches it, thinks of Marcus, wonders what he'd say if he could see her now. Probably something simple, something true. About time. She smiles. First real smile in 2 years. Yeah, about time. The city lights blur past. Elena drives toward tomorrow, toward the work that waits, toward the lives she'll save. Valkyrie doesn't choose who dies. She chooses who lives. And she's just getting started.